Our next speaker is Dr. Roger Tan. Dr. Tan is a consultant nephrologist who has been practicing since 1997, and he has a lot of experience with all stages, patients with all different stages of kidney disease from stage 1 to stage 5. So he is here to tell us, give us some hints on how one might know if a person has kidney disease. Dr. Roger Tan.
Good afternoon, ladies and gentlemen. I'm Roger here. For some of you who have known me since I was in the SGH, it's not a typo error here. I've just resigned from Singapore General Hospital about 3 days ago and started my practice in Gleneagles. So for some patients who I've just met just now, I apologize for not informing you guys earlier. But anyway, I'd like to thank KDF for inviting me for this afternoon event. And what I want to do for the next session is a follow-up from the first speaker, and that is to educate all of you with regards to the symptoms associated with the CKD, chronic kidney diseases, as well as to emphasize on the importance of screening, and last but not least, to briefly touch on some of the treatment modalities that we have. But before we talk about screening, we first have to understand how common it is, CKD. I think the first two speakers have already mentioned it is by itself a fairly common disease, and worse still, is associated with a very high risk complication of cardiovascular diseases as well. It has been estimated in the United States, as for today, there are 26 million American adults suffering from CKD. That is about 1 in 9, pretty common. How about in Singapore? Based on what you saw previously, in the 2005-2006 Singapore Renal Registry data, on the average, about 1,000 patients reach stage 5, which means to say every year 1,000 patients were started on dialysis. That by itself is quite astonishing, and we do believe that this number is going to escalate over the next few years. Unfortunately, we know that many more patients are at risk, but a lot of them are not even aware, and that stresses on the importance of screening. This chart was prepared about the early years of 2000. As can be seen here, for every 10 years, the number of patients who are on dialysis doubles. We are now in year 2010. I'm very sure we have already exceeded this number even before year ends. So no big deal, dialysis patient. But just as we mentioned, we're just talking about the tip of the iceberg. For every one dialysis patient shown here, about 10 of them has moderate to severe risk of CKD. That's stage 3 to stage 4. And as much as 1,000 patients suffered from stage 1 to stage 2, which are early CKD patients. So if you can extrapolate, 1,000 patients per year in Singapore suffered from, 1,000 patients per year started on dialysis. There's so many more Singaporeans who suffer from early stages of CKD. To make things worse, despite it being fairly common, it is by itself rather asymptomatic, which means to say most patients in their early stages, they don't complain of any symptoms, or if any, they are rather non-specific and very vague. And hence, I would like to term it by itself, CKD is a silent killer. As you have seen, they are associated with very high risk of cardiovascular mortality. So what are the commonest symptoms? They are very vague. The commonest symptoms that a patient will complain of is what you see here. They feel very tired, they're lethargic, they have no energy, they just don't feel like doing anything. But this is what a typical Singaporean, correct me if I'm wrong, whether you're working or not working, will feel. I think my kids also feel the same thing at the end of the day after school. So it does not help us. This tiredness doesn't really help us to screen for CKD. It is unfortunate, unlike heart attack. You have chest pain, you go and see a doctor. It is unlike maybe colon cancer, the gut cancer, where you pass motion, you have blood. CKD, this is the commonest, tiredness. Doesn't mean anything to most of us. Something more specific or may help us to screen for CKD with regards to symptoms-wise, and that is lower limb swelling. As Dr. Grace Leaf has already explained, kidney, one of the functions is to remove excessive water and salt. So as the kidney function worsens, the kidney is unable to perform that function, water accumulates, and by gravity, most water will accumulate around the legs. Commonly, patients will complain of will not complain of leg swelling in the early part of the day because they have been sleeping. But towards the mid-afternoon, because they are walking, by gravity, all the water will gravitate down to the lower limbs. And commonly, they'll tell you the leg swelling got worse in the evening time. A simple way to test is you can do it yourself. Press onto the bony area of your leg, one leg, just above the ankle. If you have an indentation or depression that is suggestive of excessive fluid retention, so you may try it out later when you're free. Once the leg is full, as in all the spaces in the leg, the loose skin, the fat tissue has been filled with all the water, the next area they will go is the tummy. And if that is filled up, they will go to the lung. And a lot of them, in the late stages of CKD, they will present, as what Dr. Grace Lee has said, difficulty breathing, because by then the water has already infiltrated the lung, and that by itself can be a dangerous condition. The next area that some of them may complain of is puffiness, swelling around the eyes, similar to the legs, especially so in the morning when they wake up, just by lying down, the water redistributes, and most of them will complain of puffiness around the eye area upon awakening. But this eye swelling improves as we go by the day. Something which is more specific to chronic kidney disease on the right-hand side, what we known as proteinuria, which means to say protein in the urine. Protein should not be found in the urine. Once, for some reason or the other, in kidney failure, in kidney condition, where protein is found in the urine, it has turned from a very good substance to a toxic substance that over time will poison the kidney. And some patients describe this as frothy urine, bubbly urine, for those who drink maybe like beer. For those who do a lot of household, probably soap water. The simple way to test is go down to a GP and do what we call a simple lab stick. That is for proteinuria, rather specific for kidney diseases. Next, on the left-hand side is what we know as hematuria. That is blood found in urine. This is rare for kidney disease to present with what we call gross hematuria. That means you can see the blood with your naked eyes. Most of them present with what we know as microscopic hematuria. That means you have blood in the urine, but it can only be detected on further testing through laboratory means. If you can imagine, a kidney is just like a filter. It filters all the good things, keep all the good things, protein and blood in your body. But when kidney failure progresses, or in kidney diseases, this filter, the holes gets bigger, and with it, the good substance now has flowed into the urine, and hence become toxic. And that's why you can account for these two phenomena, both the proteinuria as well as hematuria. Other non-specific symptoms, poor appetite, insomnia, dry, itchy skin. Some of them really scratch until pretty bad. All these can be seen in various stages of CKD, and these are mainly due to the accumulation of toxins in the body as the kidney fails. The next less known symptoms is that of increased urination. Patients complain of increased frequency of passing urine, typically so at night. This is due to the loss in the concentration ability as the kidney function fails. But having said all this, having seen all the symptoms that's been shown, I think this is the second time you're seeing it already, I still have to stress again, these are by itself very vague, not commonly seen in the early stages of CKD. And if they are, they are very non-specific, and hence there lies the importance of screening. Before we can talk about screening, we must understand whether is it cost-effective to screen. I've already shown, and I'm quite sure right now all of you are convinced, CKD is a fairly common disease. The next thing before we talk about screening is who are the people we should screen. And just to bring out the same point again, I've just listed here the commonest causes of CKD that we see in Singapore. Top on the list, diabetes, account for up to 60% of patients who develop kidney failure annually. I'm quite sure this figure has gone up. I think based on the last data, MOH, 1 in 12, quite astonishing to me, 1 in 12 adult Singaporeans do have diabetes walking around. That's quite astonishing. The second commonest cause, as Dr. Grace has highlighted, is chronic glomerulonephritis. This is a chronic inflammation of the kidney. And because of the inflammation, the holes in the kidneys has got bigger, and with it, protein leaks out, blood leaks out, and after a long while, it is toxic to the kidney. And that's how kidney failure happens. And next to it is certain form of inherited disease. Commonly, what we see in Singapore is polycystic kidney disease. This is by itself an inherited disease, and can be, if for example, if your parents have polycystic kidney disease, there's a 50% chance you will develop, or the siblings will develop a polycystic kidney disease as well. What it means in polycystic kidney disease is the normal kidney tissue now, because of some genetic disorder, has been infiltrated or replaced by cystic structure, water-filled structure, and with it, the normal kidney function has been lost. And that's how kidney failure happens in polycystic kidney disease. Hypertension, here we hear again, fairly common. 25% of our local population have hypertension. But to make things worse, hypertension itself is also rather asymptomatic. Most of them, the most will complain of headaches, which I think lately, because of hot weather, a lot of us will have that. But hypertension by itself is not just a cause. It is also a complication associated with CKD, chronic kidney disease. Last but not least, the next two, obstruction, be it from kidney stones, be it from prostate enlargement in elderly male, and last but not least, recurrent urinary tract infection, to the extent that the infection spread all the way up to the kidney, can account for quite a significant number of percentage of our kidney failure patients in Singapore annually. So with that in mind, knowing the causes of kidney failure, knowing that it's fairly common, who are the persons who we should screen? As a whole, everyone should be screened, but certain patients who are at higher risk, and these are the patients who have a positive family history of CKD, who are diabetic, hypertension, as well as elderly patients. These are the patients who should be screened, in my humble opinion, at least annually, to make sure you are free from CKD, or if you have, treat it early and you have beneficial effect from early intervention. What are the simple tests that we can do? Some of you may have done one form or the other of these simple tests that I've highlighted. First on the list, a simple blood pressure measurement. With that, you can tell yourself whether you have hypertension, and for some reason, if you have hypertension, you may want to screen for whether you have CKD, or maybe it also highlights to you the need for intervention as well. And as what Dr. Grace Lee has highlighted, if for some reason you have CKD, optimal hypertensive control plays a paramount importance with regards to prevention of CKD progression. Next on it is urine tests. A simple urine laboratory lab stick test can tell us whether you have protein in the urine, whether you have blood in the urine. This is suffice in general population, but I should say in patients with at risk, who are at higher risk, diabetic patient, I will propose a more specific and sensitive test, and that is through sending your urine to a laboratory where we can pick up early traces of protein. And that has been shown if early intervention through medication comes in at the early stage, the beneficial effect is enjoyed throughout the next few years. Last but not least, a simple blood test for what I would normally term as kidney index, the serum creatinine level. The serum creatinine is a reflection of our kidney function. The higher it goes, the worse your kidney function. So when you go and see a doctor, all they need is just do two simple tests and one blood pressure measurement, and there you have the answer whether you have CKD. The last part of my lecture, of this talk, I'm just going to touch on briefly the treatment modalities that we have available. Healthy lifestyle plays a pivotal role in the treatment of all sorts of chronic diseases. Hypertension, diabetes, asthma, as well as chronic kidney diseases. Regular exercise, as what Dr. Grace Lee has said, minimum 3 times a week, do plays a significant role. weight reduction is tagged on to exercise. It has been shown, if you can, and I believe, if you can reduce your weight by up to 20 kg,